Dr. Darien Sutton joins us now with the question that you were asking online. So this is a question from a viewer. Is it bad for you to wear earplugs while you sleep every night?
Short answer is no. As long as you're washing your hands and keeping your earplugs clean. There are different types of earplugs. You can get wax, you can get foam, you can get silicone. Wax and foam are commonly used, but the one that you can only really reuse is the silicone earplugs. So if you're using them, make sure you wash your hands, make sure you keep them clean. And the reason why is because it increases your risk of earwax buildup and ear infections if you don't.
Wow, that's so. All right, what's your prescription for wellness today?
It's headaches. It's one of the most common presentations or most common reasons that people come into the ER. And often I'm educating patients on the different types of headaches because knowing the type of headache that you have kind of details or dictates what kind of intervention I'm going to do. That means cluster headaches, tension headaches, as well as migraines. There are some basic things that each and every person can do. First and foremost, sleep. Exercise and hydration are key. That helps you to prevent headaches. When you do get a headache, most of us know this, going to a quiet, dark room without screens because that can worsen your headache. And then something that people often don't realize is magnesium supplementation. If you have chronic headaches, we're often deficient in magnesium. And so searching for a good magnesium supplement can help you reduce your risk of recurrent headaches.
I like that topical magnesium. You ever try that?
I've never
tried that.
Yeah, you guys are over here using magnesium all the time too. What is it about exercise that helps prevent headaches?
You know, at the end of the day, it's decreasing your body's overall inflammatory response that can sometimes trigger your immune response. So those that exercise more have more stable numbers. And so the thought or the theory behind that is that that's what prevents their headaches.
I knew whatever question I asked, you'd have an answer.
And you always have a new question.
And if you are constantly having headaches, not a good idea to just keep popping pills.
Absolutely not. If you have recurrent headaches, it's absolutely not to just go and continue to, you should get evaluated, at least have a formal exam. Some red flag signs, if you have a sudden headache or if it feels like a thunderclap or if you have changes in vision or neck pain, you have to get to an emergency room so that you can get evaluated to rule out the dangerous causes.
That is what I was going to ask next, about when you need to get to an emergency room as soon as possible. What's like the #1 thing? If this happens, get there.
Sudden headache, and if it feels like a thunderclap. If it is sudden thunderclap, or if you have, neurological symptoms, changes in vision, weakness, you have to get to the ER.
And cluster headaches. Can you just real quickly, we only have a couple seconds left, but what exactly is a cluster headache?
They're often one-sided. They predominantly happen in men, and they can present with tearing of the eyes and also congestion, sometimes mixed up with sinusitis. And the treatment often is oxygen therapy.
All right.
Which is why it's important to know what type of headache you have.
Absolutely. Send us your questions at ABCGMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.